HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Meet our new chair of behavioral health, Dr. Rashi Aggarwal. Hear her discuss Northwell Staten Island University Hospital's new approach to behavioral health for the community, with a focus on providing more options for care in this much-needed field. Give it a listen.
Hey, Staten Island, welcome back to HealthWish. I'm here with Dr. Rashi Aggarwal, our new chair of behavioral health at Staten Island University Hospital. Welcome.
Thank you.
And we are on the beautiful grounds of Snug Harbor at the Staten Island Children's Museum. And yet again, another one of the amazing cultural institutions that exist on Staten Island. Dr. Aggarwal recently came to Staten Island. We're really excited to have her. Tell me a little bit about yourself and tell me how you ended up on our fine shores.
So I'm a psychiatrist by training, and I have always loved education. And my first job was at Rutgers, New Jersey Medical School, where I was a CL psychiatrist, but very soon got engaged with education. Spent all my working life there as a training director and eventually as a vice chair for education. So ended up at Staten Island because I felt like I had done all I could do with improving the training program and really wanted to do something that impacts patients directly, really concerned about access to care that our patients have, and wanted to make an impact. And as chance would have it, I've never lived in Staten Island, but I've always had an affinity for it. Like 3-4 years ago, I remember walking around in Snug Harbor grounds, just as a tourist, honestly, from New Jersey, and loving this place. So I'm really glad I ended up here.
I would love to talk about something that you just mentioned, though, in terms of trainees, right? Staten Island University Hospital has added so many training programs to the institution over the last 15 years, and psychiatry is one of them. Give me a sense of why having the physicians of the future being trained in your own community, why that can be so important to a community.
You know, there's a general thing, but for psychiatry specifically, there's such a shortage of trained psychiatrists in our country that almost every community in the country is struggling to find psychiatrists. So having residents, having people who are part of our culture, part of our community, training in psychiatry increases the chance that they'll want to live and work here and treat our patients here. So it is really valuable.
But just since I came here in 2004 as the director of emergency medicine, we added programs in emergency medicine and radiology, in pediatrics and behavioral health, really adding probably somewhere near 100 residents there, and happy to report we'll be adding our first anesthesia resident to Staten Island in July.
That's wonderful.
Yeah, talking about investing back in this community and training the doctors of tomorrow that are going to take care of this community. So that's a little aside.
I just want to say I'm so happy to hear that, because a lot of hospitals will not want to do that because training residents doesn't generate the finances. It's much more lucrative to actually just focus on specialties that bring in money. So training in education is so important. So it's just so nice to see that we are doing this.
Yeah, it's part of the mission, and understanding where we're going and understanding that this is the kind of place that you can do this, and we actually perform so much medical care that you can really train wonderful people. And the other cool thing is, the phrase they use is Staten Island shows really well. If you expose trainees to Staten Island,
yes,
their likelihood to come back and work on Staten Island goes up exponentially. It's a wonderful place to live, it's a wonderful place to work, but if they've never been here before, sometimes their only exposure to Staten Island is, oh yeah, that's the place that I drove through going from Brooklyn to New Jersey, and this changes that.
That resonates so deeply to me. It feels weird to say this, but I'm in love with Staten Island. And again, my only exposure to Staten Island was that horrible traffic artery driving to Brooklyn for my residency. So in the last few years, when my husband and I started exploring a little bit more, and the boardwalk, the Snug Harbor, like, this place is amazing.
Yeah, it's really a wonderful place to live. So many great neighborhoods from North to South Shore. So we are in the Children's Museum. And I thought it'd be great to start talking about behavioral health in children. I think most of us know how much of a concern that's become and how much of an issue it is. Tell me a little bit about that, and then tell me about some of the wonderful things that we're doing here for that.
Children's mental health is both a very serious topic, but also a very optimistic topic for me. So there is a national advisory, the mental health for children in our country. The words that are used are crisis, really, which means that we have children who have serious psychiatric issues like depression, anxiety, bipolar that are not getting treated. So it is an urgent issue where we need to focus on treatment. But at the same time, it's an issue where if you focus on prevention, if you focus on fostering mental health in children, we can have such a big impact on community in the long run. So it is the most optimistic intervention point. The reality is that there are a lot of children who need mental health treatment and are not getting it. So I'm happy to report that we do have flourishing child psychiatry services, and we are actually working on starting a child urgent care. So children who need behavioral health treatment urgently and have to sometimes wait for months for appointments will be able to get it pretty much within a 24, 48-hour notice.
So that's a big deal, what you're saying here now, right? I mean, I think everyone now is familiar with the idea of urgent care, right? I mean, a place that you walk in, no appointment, and you actually get medical care. So you're actually going to open a place where somebody who doesn't have an appointment can be seen fairly quickly at a crisis point.
Yes, absolutely. We are exploring how best to do this, but the plan is to open it, yeah.
So more to follow. You'll be hearing a lot more about this, but this is something that we're talking about and that will become a reality. We're just working through it. And you talk about finding people to go into psychiatry and actually how hard it is to get people. Child psych in particular.
Among psychiatrists, there's enough interest in child psych. So it's not that we are not going into child psychiatry. The issue is the same as there's just such a higher need. But the number of child psychiatrists we are training now is higher than we were training 20 years ago. But the need is higher. So the numbers are not keeping in touch with the need. And the problem is that it's the reason there's not enough child psychiatrists is because there's not enough psychiatrists. So you can only become a child psychiatrist after you're trained as a psychiatrist.
Which makes sense.
So there's a lot of interest from our medical students to come into the field of psychiatry.
Psychiatry has become one of those things where there are real career options.
Yes.
It's almost gotten to a point where you could spin a map or spin the globe and decide I want to work right there, and you'll be able to get a job in psychiatry. It's become that competitive when you get out.
Not just get a job in psychiatry, you can write your ticket. Like even we are hiring, like everywhere you go in the country, in any academic institution, there is an opening for a psychiatrist.
So we do okay in terms of being able to find people, but at the end of the day, this is one of those fields, all mental health, whether you're talking about social work, whether you're talking about being a nurse practitioner, whether you're talking about being a physician, there's tremendous opportunity in mental health. And I think it's something that people out there should be thinking about.
That is absolutely true. Like it's not just the psychiatrist, even the counselors. Like you can think of any level of psychiatric care or mental health care, the demand is really high.
You can't really talk about mental health in this day and age without talking about the opioid crisis and about what we as a society, and we particularly in Staten Island, are trying to do there. It's really become the scourge of our society. I think many of you have heard me say on this program, actually, that I do believe that history is going to judge our generation based upon how we handle the opioid crisis. And I think maybe we're starting to do a slightly better job, but I think, frankly, prior to the last few years, I think history was going to give us like an F-. I guess the question I have for you is, as the new leader of behavioral health in Staten Island, what are we doing and what are we already doing? Where is our footprint? Because our footprint is pretty significant. Yes.
Opioid crisis is a problem everywhere in the country, but we do have a higher rate than our neighbors, which is very troublesome. And I do think that SIUH has already been making a big impact. We actually have 3 methadone programs that are actively treating patients. What people sometimes forget is that substance use can be hard to treat, but with the opioid crisis, the good news is that we have treatment that works. So there is methadone, there is Suboxone. They are all treatments that have a very high efficacy, which means that they get patients well and sober and functioning and happy. On our part, in addition to the methadone treatment program, we have a CATCH team, which is dedicated to substance use treatment. And their main job is that when patients come into the hospital for any reason, right? You're hospitalized for a pneumonia or anything at all, and we know that they have opioid use or any other substance use, our team goes and treats them there, starts them on medication, links them to outpatient treatment, because unfortunately, as much as psychiatry is stigmatized sometimes, as you know, substance use has a lot more stigma. Many of us will take it personally that my daughter, my son, my brother has opioid. Like, we consider it sometimes shameful, which makes it harder to get treatment, which makes it harder for our loved ones to get treated. So connecting them when they are willing to get into treatment is the biggest thing we can do. So our cash team works on that. We have a bridge clinic where the psychiatrist that started them on the medications in the hospital will actually see them in the outpatient clinic. So there's that warm feeling that you know someone when you're walking into that building, because the anxiety, the anticipation can be difficult. But in addition, we also go out in the community, because ultimately what happens with opioid use is that you want to say, this is not my problem, this is yours or yours. So by going out in the community and educating people in the community that you can make an impact. It's not just about, if you can understand what are the signs of overdose, you can actually save somebody's life. And somebody's life can be saved very easily using a Narcan spray or a naloxone kit. And the training, you don't need to go to med school for that training. So we, in our department, and I think last year we did, 1,600 and something educational sessions for people in the community, focusing in on areas in Staten Island that are more vulnerable.
Join us next time as we continue the conversation. HealthWish wishes to thank our special guests, Dr. Brahim Ardolic and Dr. Rashi Aggarwal, recorded at the Staten Island Children's Museum in Portia's Playhouse. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.